So today I thought it might be a bit interesting and a bit informative for our patients to know exactly where the incision sites are for facial procedures. So I have an eyeliner pen and I'm going to ask you to draw on my face where the incisions are for different types of facial procedures, and if you can just explain why you're drawing on me.
Okay. Start off with this as a crayon. It is not a scalpel.
Thank goodness.
Let's get that clear. I want to show first of all, when I'm doing rhinoplasty surgery, so nasal surgery, I use an open approach, which is an incision in front of in the columella, this area here, and it's a little it's a little step cut, so it runs across, down, and across. A bit difficult with the crayon. So it just runs across, down, and across. That's the only scar externally for a open rhinoplasty. All the other scars are internal only. With the face, typically we want tightness of the skin in this area. So I start off with a scar that's in the hair, so it's hidden. It comes down. In order to make it stand, in order to minimise the scarring and the appearance of it, it's good to hide it in whatever contours we've got around the face. So to go around the ear, rather than making a straight line down, I would go around the corner here. I'd go inside this bit of cartilage here, again so you can't see the scar, around to the bottom of the ear, around the earlobe, like so, up behind the ear and the scalp, and across into the hair and then down in the hair. That would be my typical position for scarring. Always these scars vary a little bit on the patient. It's different for men than to ladies. I can put scars at the bottom of the hairline here. On some patients that's uncommon compared to where I put them there. So that would be my standard facelift incisions for the majority of patients having a facelift. So we have lower and upper blepharoplasty. A lower blepharoplasty is scars just below the eyelashes. I'm going to point rather than draw. So the scars are just below the eyelashes. They come across to the corner of the eyelid and just out a little bit here. That allows me to correct any issues in the lower eyelids. The upper eyelids, the scar, again, I'll just mark it rather than use the crayon, runs from here on the inside of the eye out to the corner here. It goes in the crease that when the eye is open, the scar is in the crease so that you don't see the scars with your eyes open. The brow lift, the scars are in the hairline. 2 scars about 1 centimetre long, one about here in the hair, and that's it for brow lift. There's no other scars on the forehead or the face at all.
It is important to keep in mind that no two faces are the same. This is just a general guide of where an incision can be made, but treatment plans are tailored to the particular concerns and facial anatomy of the patients themselves. For any other facial surgery questions, or if you'd like to perhaps book a consultation with Dr. Doyle, please feel free to give our practice a call on 0755 980 988. If you select option 2, you'll come straight through to me and I'll be able to help guide you with the next steps.